Imagine coughing and suddenly seeing blood. It's a terrifying experience that can leave you feeling helpless and anxious. Hemoptysis, or coughing up blood, can be a sign of something serious, like lung cancer. But what exactly causes it, and when should you be worried? Hemoptysis occurs when blood is brought up from the lungs or respiratory tract, often mixed with mucus. It can be caused by infections like pneumonia or bronchitis, but also by lung cancer. In fact, about 20% of people with lung cancer will experience hemoptysis. Sometimes it's one of the first signs of the disease. If you cough up more than a teaspoon of blood, or if you have chest pain, shortness of breath, fever, or dizziness, seek medical attention immediately. Treatment depends on the amount and location of the bleeding.